We've started to see a rapid increase in the last few weeks in younger people. And that's reflected in some of the numbers that we're seeing, as well as the discussion we've had over the last few weeks of exposure events, particularly social events, parties, get-togethers where younger people are coming together and the virus is being spread. The top line in the sort of dark pink is the 20 to 29-year-old age group, which we can see has gone up the most. And the green line just under that is 30 to 39. And we're now seeing that the proportion of cases by different ages has shifted. And in this graph, you'll see the proportion of cases in different age groups by phase of our pandemic. So the first bars represent January to May, January to middle of May, and we can see it's fairly evenly distributed. What we see is a preponderance of older people, and as we recall, many of the people who were infected early on reflected the outbreaks we had in long-term care homes. So there was younger people who were the healthcare workers providing care, and older people. And as we moved into phase 2 of our pandemic here in BC, we got a hold on some of the issues around long-term care, and we started to see an increase in younger people. And that was reflecting transmission events that we were seeing and some of the outbreaks we were seeing in workplaces, some of the poultry plants, for example, the correctional facilities, and younger age groups being affected. And now, between June and August 8th, we've seen a much broader increase, particularly in people in their 20s and 30s. And this is, again, related to some of the social events. There is still, of course, people reflected in there from workplace exposures, including healthcare workers, but it is also being driven by what we're seeing with people gathering and having social connections where this virus can be transmitted quite easily. These two graphs give us a better sense of that. When we look at the one on the left is under 20 years of age, and then from 20 to 39. And what we see over the 3 phases of our pandemic here in BC is that we've moved from having household contacts and being involved with outbreaks to having a shift in the connections and the exposure sites where younger people are getting exposed and infected. And what we call those our other known exposure really refers to places like bars and clubs and parties and social events that we know have been an issue in the last few weeks.